Good morning, everyone. Thank you for joining us. I'm Rich Ditizio, the president of the Milken Institute, and this is part of our ongoing webinar series. Today, we're focusing on the philanthropic response to COVID-19 across the Asia Pacific. So I wanted to talk a little bit about what is the role of philanthropy globally. We've seen some $8 billion in philanthropic capital flow towards COVID since the crisis has unfolded. That is some exponential number of what the typical annual giving is. And I want to talk about what its effectiveness has been, what the role of philanthropists working with governments around the world has been, and the experience as COVID has unfolded. And talking about the great pivot, as I would call it, to the whole world being at somewhat of a standstill, focused on the eradication of this disease and its treatments and trying to find vaccines. One thing that we have done at the Institute is pivot all of our centers towards this initiative. So we have loosely divided ourselves into those that are focused on the medical end of this and those that are focused on the financial ends. I think one of the interesting things of this is often when I meet people and they look at all the different centers that are under one organization here at the Milken Institute, they don't really understand how all of these things possibly relate to one another, how we're fighting disease and working on financial regulation. And I think in some odd way, this pandemic has shown just how interconnected many of those themes are. So the obvious catalyst for this was a pandemic from a virus, but the economic fallout has been very fast and very severe. So on the good news front, our Faster Cure Center is currently tracking some 335 different treatments and vaccines, antivirals, et cetera, that are in process around the world. Probably a dozen or more have already entered clinical trials into humans, which is at a speed unseen before. And I think that we're actually looking at repurposing existing drugs and therapies, one in particular that came up through our sister organization, the Prostate Cancer Foundation. Since men have a disproportionately worse experience with this and a much higher death rate, there was the notion that perhaps testosterone was fueling the virus in its invasion of lung cells, and that actually has proven to be at least preliminarily true. So we've been thinking of this testosterone suppression therapies that actually have shown some early promise. So I think, unlike prior issues that might have been health related, in this instance, the entire world, academic institutions, major pharmaceutical companies, scientists globally, are singly focused on this, which is hopefully going to lead us to many therapies and eventually a vaccine. So what is the role of philanthropy in all this? I mean, you've seen as the virus has made its march around the world, parts of the world have had very limited exposure to it, a great result, few deaths. Other places, we're watching very closely the African continent. Right now, there's 115,000 reported cases and only 3,400 deaths. But in places where there's very little public health infrastructure, no testing in many parts of that continent, so you can see that the spread, once it starts in earnest, would be quite robust there. And then how are we thinking about advising governments with their economic response, the great stimulus that we've seen coming from governments all over the world? Here in the United States, you have 39 million people unemployed, and the speed with which that has happened has disrupted economies around the United States. Unlike many of you in different countries, in the United States, it's a state by state, often county by county experience. And the laws are different, the rules are different. So there's no ability to really contain it because there's no restriction on traveling between the states. So what is government's role and what is philanthropy's role in all this? Often when we think of causes, philanthropic capital can take greater risks early on and be a catalyst, but when you need mass distribution, as we do here, by design, you need government's involvement. So let me start in Australia with Andrew Forrest. Andrew, I know that you have done some work on funding, testing, and medical supplies. Tell us a little bit about what the government response has been, and because Australia and New Zealand next door seem to have had very good results and a limited number of deaths from the virus. So give us a sense of how you're thinking of your own philanthropy in Australia.
Yeah, thank you, Richard. Thank you, Milken, for calling this important conference. New Zealand and Australia were a little bit different. New Zealand went really hard, shut everything down, and that will make economic recovery harder again. But it was very effective in containing not just this virus, but every virus. You know, everyone in New Zealand, like in Australia, isn't suffering the common cold or the flu, which we normally get at the onset of winter. We're all, you know, in pretty good shape. Australia was a little bit different. We went to shut everything down. It's apart from really critical essential services, which either could control workforces with a fair bit of discipline, or just weren't sensitive to a lot of human interaction. We kept those industries going, and that'll mean, I think, that we should be able to recover quicker, and both countries will be or are now beginning to rely on qPCR RNA testing, the gold standard in viral testing, including COVID-19. And while either country, in fact, the world doesn't have a vaccine, then our only way through this with confidence is through that RNA testing.
And Binod, for you, in a country like Nepal, I know that you've given some testing kits to the Nepalese government. Talk about the collaboration and what, have there been any issues as you started to work with the government on distribution?
Well, let me take you back to the time when we started seeing the early signs of the pandemic. I don't think anybody was prepared. I think that applies to many countries, and Nepal was not the only one. We had only one major center where PCR tests could be conducted. There were no availability of PPE, and so there was when there was the outburst of this problem globally, there was a scare factor that impacted the health workers and doctors, and so it was a pretty much of a situation where I think the state and people like us did not know which problem to tackle first, and then we had to quickly mobilize the PPE and get them across. The country was in shutdown. Movements were a problem, but still, so we had to arrange for these equipments to be made available, because the first task was to make the people safe who would be willing to tend to the problem. And the second then was to organize the equipments in different centers throughout the country, and then the reagents. And then there were a few wrong decisions made. For instance, like the rapid testing kits, which has come under serious question about its reliability. So we managed in the first phase to sort of distribute in almost more than 120 centers throughout the country, then at least give them a sense of safety. And the time, luckily, the numbers were not big. You can argue that the numbers were not big because we were not able to test. Until recently, we were only about 80 cases, which has now very rapidly grown to 900. In the meantime, the PCR test facilities have been strengthened, but far less than what we need. Our plan is to reach a 2% of the population to be tested, which will be close to 500,000. And that's a number far away, and we're still fighting to get put the equipment and the systems in place. But that's becoming a smaller issue, because the influx of the people from the bordering parts of India, which is huge. We have 1,800 kilometers long Indian borders, and more than several million people who work there. And they've been now that India has opened up, trains have resumed, they all want to come back home. And we are having a tough time trying to find a reasonable way of sort of providing them with temporary shelter, quarantining them, giving them food. So I think there is a serious issue in terms of managing all these, and We are trying to work with the government and the state government. We have 7 provinces in Nepal. The biggest part of the problem in the far western part of Nepal, which borders more with the Indian, bigger population, the UP, the Bihar, So it is. We are fighting the situation so far, as I mentioned, about 900 cases already positive, only 4 deaths, and we believe that it's going to grow. And so we are clearly working to prepare ourselves, mobilize the private sectors to focus in supporting the quarantine facilities. And then, the worst, like earlier when we used to have problems of this, of a bigger nature in terms of natural calamity or even any other disaster, at least the other countries would come to help. But today, every country has their own problem, and they're not even able to so we have no choice but to manage the problem on our own. In a way, it's good. It will make us stand on our own feet. On the other hand, there are limitations, but we are fighting it. Let's put it this way.
Okay, good. So, Laurence, I want to turn to you. It was a year ago this month that we were all together here in Los Angeles talking about East-West philanthropy and the collaboration and learnings we can share across geographies. I want to ask you a little bit about the power of networks. The Asia Philanthropy Circle obviously was your idea to pull people together. Are you seeing some efficiencies in the way that people are strategizing around their philanthropy? And what have been some early lessons through the COVID epidemic that you'd like to share? And you're on mute, so it's okay.
Okay. I think this COVID crisis has brought to light, how important it is to collaborate and to work together. Because the situation is so rapidly changing that philanthropists who can't put boots on ground because we are online can be a bit disconnected with the issues that are evolving, and the government is dynamic in its response, so the gaps that appear one day may be different tomorrow. And the size of the problem is just so huge, right? And absolutely growing. So I mean, for APC, the Asia Circle, we've adapted to this. We've got a lot more regular online dialogues like this. Looking at COVID issues and COVID responses. We're going country by country. It's really about what's going on, what are the things that are worth doing by philanthropy, because frankly, even though the dollar makes a lot more, is more important now than pre-crisis, the size of the problem is so huge that the size of philanthropy is so small compared to the government response. I mean, the Singapore government has put what, $100 billion on the table for COVID response. That's 20% of the GDP, right? Private philanthropy is, in the best of days, is no more than 1%, and it's, even if you triple that, it's not going to be anywhere near the size of the government budget. So we have to work together to say, well, where can we best use the philanthropy for innovation, for longer term issues, for issues that people are. I mean, the government can put in place big policies, and they are coming with policies on the fly, right? And it leaves a lot of small gaps, some big gaps that I think philanthropy can pick up. And I think it's also not looking sufficiently at longer term issues, which we are looking at, on livelihoods, on the economic fallout. And many of our philanthropists are business people. I mean, they have got, I think what you will see is business and philanthropy being very, very closely intertwined. One of our members, the Ayalas, they announced a 2.4 billion package, right? COVID, that's 2.4 billion pesos, which is about 200, what is it? 500 million Singapore package. It's business and philanthropy, together as a response because we've got to build jobs, take care of our workers who are still with us. Right.
I think that you bring up a good point. One of the is the agility of philanthropy, and yes, from a scale perspective, governments are always going to have an outsized impact, but it takes longer to get that through. Certainly in Singapore, probably a little quicker. In some place like the United States, where things are working their way through Congress, and philanthropists here kind of sent their jets to go pick up ventilators and bring them to the front lines and funded PPE right away. So I think there's a great tactical response while the largesse of governments is waiting in the wings. So I think, Cherie, let's turn to you, because I think I saw a slide that you presented that the GT group actually, speaking of tactically, has 3 focal points. It's value creation, resilience, and regeneration. So maybe talk to us a little about how you settled on those 3 pillars, and then what your experience has been since you embarked on your COVID work.
Thank you. Thank you to Milken, and also to, I think, Laurence is our friend from the Asian Philanthropic Circle. And we would like to, I think, share for our, I think I'm based in Singapore, but I'm Indonesian and have been also working closely as an advisor to the government. And I think when this started, because we also have operations in China and Singapore and other parts of the world, so we had an sort of a early warning of how severe this is, and so we have started to consider how to sort of from the business perspective what we can do. I think on the resilience side, I think all the aspects that a corporate can do to, because I think in Indonesia, it's similar to, I think, what Andrew said in Australia, where some of the operations are still functioning. So it is not a full lockdown. So we had sort of like disinfectant chambers, we had different procedures, different processes that was we had to implement in our own operations. But further to that, we are thinking longer term, what could, because the healthcare system, we realized sort of the inadequate, it was already in need of a lot of investments and also people resources to make it stronger. But when this hit, all the cracks sort of, started opening up. And so we, as companies, I thought we could, we could invest. So we invested in mask making machines. That's the value creation part. And we have also some of them, others, we kind of short-term mobilize them to make the PPEs. And, even the masks, all the different aspects, we mobilize different parts of the companies, basically voluntarily, but I think that we also encourage others. So I think that has, is already operational, and I think we have already sort of started donations to the governments as well as to the hospitals directly and to the necessary communities in the regions. So I think we feel that the third part, I think the regeneration part, I think value creation, resilience, regeneration. We also, I think some of this borrow from the WBCSD and International Chambers of Commerce, where we have some relation with, and I'm also on the board of ICC. So we want to look at future business models that could survive in this really very challenging environment. So I think a lot of it is linked to the digitization, and we also work with the government. So we are fortunate that the person in charge of our GTAC, which is our technology platform, he was a former Minister of Information Communication, and he is now sort of also working with the government and a task force supporting the ministries and also the president on the e-commerce and digitization to support especially the SMEs and I think those that are cooperatives or farming, all these areas. So there is a need of a global or at least a national that I think this is an issue that is also global. I mean, our operations in other part of the world, we are also looking into this regeneration aspects. Thank you.
That's great. Thank you. So Andrew, let me go back to you. I know that your foundation is focused on a multitude of things, one of which through your daughter Grace, who we had as a speaker on slavery and global slavery, is an issue that doesn't go away as the world pivots its attention elsewhere. And in fact, I would bet that while everybody's focused on other things, those who are ill-intended in the world are taking advantage of those gaps. So how do you think as a philanthropist about your own capital and like kind of when the acuteness of this moment subsides and you're going to have to go back in and pick up the work that you were doing before? I mean, is there a concurrent effort while you're keeping that going, or are you thinking mostly let's solve COVID first and then go back to those issues? And how do we address that as a philanthropic community?
I think our first objective when the COVID crisis hit was to look after Homebase. So we, as was just mentioned, we made around $100 million available. Fortunately, didn't have to spend it all on PPE, and then about $250 million available for qPCR machines and 10 million tests, so that Australia would be in strong shape. Immediately that was done, we could pivot our attention back to what you have referred to, which is modern day slavery. And what has occurred, as your comments premeditate, is that slavery has increased during this crisis. Slavery has been more greatly exploited, and worse still, where those who work in slave-like conditions were vulnerable previously, they become extremely vulnerable to lockdowns, to not being able to travel back to their homes, to the range of measures which were put in place by governments, which now make those very vulnerable people absolutely exploitable. And if they're not protected as much as possible by either government or philanthropy, and we've put a lot of capital aside to do everything we can, then the exploitation rate increases. And what we've seen really all over the world is an increase, not a decrease, in slavery, and an increase, not a decrease, in human exploitation.
Unfortunate, but not unexpected. One of the things that came into sharp relief here in the United States was the fragility of the food system in feeding people here. And I would imagine, as you think of sustainable growth, and I know that's important to you, sustainable development in Nepal, are those gaps being exacerbated by the current COVID crisis? And what role can philanthropy play in trying to mend some of that?
Well,
yeah, go ahead.
But go ahead, Andrew. I think you're asking me or Andrew? Rich?
I think Binod, but Binod first, and then Andrew, if you have a comment on that, please.
No, I think of late, this is becoming, for the last 7 or 10 days, this is becoming a major issue, because as India opens, as I mentioned, from more than 15, 20 different points of Nepal, people are trying to enter in. The government is under serious pressure that why they won't allow the local people, the Nepalese people who are working outside, to come back home. So that has resulted into converting most of the schools or any facility that one gets in the bordering part of the country into quarantines, which is not really quarantine, and also organizing the supplies of proper food. So there is an issue. We are trying to, I think everybody is coming together to address that. So as I mentioned earlier, the problem is people have started to enter in big numbers, much bigger than what we can handle. How do you deal with the testing part? If if you don't test and if you just let them go to the villages and the mountains to the other cities, and obviously that's going to be a disaster. And if you keep them there, you don't have the facilities, including the food. So it's a very tricky situation both ways. And then one has to create very quickly one has to find the answer very quickly, and that's what I think that's what we all need to do, and we are trying to do. Not to talk about the subsequent issue, which is not going to be too far, because I think our estimate is that we'll have close to 1 to 2 million people coming in from Middle East, Malaysia, and India, because we have 26 to 30% of our GDP is remittances, migrant workers. And once these people come in, you need to find a way of absorbing them to avoid social conflict. Supply chain has come under a serious threat because a lot of supplies make it to Nepal from India or via India, even if it's coming from other country, and that is simply not. It's functioning, but it's not functioning the way it should. The markets are closed. So we do have multiple issues that we are trying to handle at a time. And then with limited resources, the administrative capability of the newly formed federal structure, the governments, Nepal was a centrally ruled country in terms of governance, which has now become 7 federal states, and each of the federal state is trying to put their act in place. In one way, that has been helpful because there is a lot more focus, and every province, every state is trying to sort of get down to the work. But on the other hand, they all need to be supported by food, medical equipments, testing kits, testing instruments. So I mean, I think through this medium, we have Laurence talked about the power of collaboration, and that's exactly what we did during the 2015 earthquake, when we had the problem of earthquake of a magnitude which we did not know how to cope up with. And our foundation sort of went public in social media and wanted advice, support. And we were lucky to have found a couple of partners who had faced similar situation. We were able to create homes in 7 days, shelters. And then these shelters were distributed in all those affected areas. So today, I'm once again calling on potential, we're not asking for grants or donations, but ideas, linkages, which will help us to find answers to some of the issues. The issues will be quick mobilization of the quarantine facilities in terms of supports, how the other countries are doing it. Quick, and then, it's not about one time, and I think it's going to be a matter of a few months to sustain supporting constant supplies to these camps of at a minimum required healthy support system ranging from food to water. And in the meantime, and most importantly, finding a more affordable solution to testing. PCR is expensive. Mobilizing PCR equipment is expensive. Installing ICUs and ventilators in the local, very mediocre or a modest health facility, including the support system in terms of human being, is not easy. It doesn't happen overnight. So these are the kind of issues we are fighting with. I'm sure there are many countries who are fighting with similar problems. If anybody can give us some leads, some ideas, we'll greatly welcome. We're trying to do what we can. Thank you.
Andrew, did you have a comment on that?
Yeah, I think it's really important to protect supply chains, and I separate point that qPCR is expensive, about $100 a test. But I'd also say to all the entrepreneurs who are watching the show, this conference, that investing in qPCR is a really good investment to help out countries like Nepal. If we can bring down the cost of the reagents dramatically and bring down the cost of the machines, then countries like Nepal and across the world will be able to afford it. And what Dr. Chaudhary says is that it's expensive, but unfortunately, everything else is like shutting the gate after the horses got out. So if you do an antibody test, or if you do a no-touch thermal test to try and pick up symptoms, that person is already highly contagious, or you may not pick it up at all because this particular disease has such a strong asymptomatic ability to spread itself without any sign whatsoever. So really, I'd strongly suggest government sponsorship to bring down the price of qPCR, or entrepreneurial investment to bring down the price of qPCR, and then protect supply chains, critical supply chains like health workers, police, teachers, meat processors, food transport industries. Make sure they're all qPCR tested so that those supply lines can at least keep the most vulnerable in our community, which will be suspected or will be vulnerable to slavery. Without that protection, will keep them protected. That's the concrete, real way we can make a very serious difference for both on the science side and on the human rights side.
Mm-hmm. Great, thank you. So the World Bank is predicting that across Asia, some 24 million people who were about to be lifted out of poverty will stay there, and another 11 million people might actually be drawn into poverty. So Laurence, let me turn it to you. What do you think, back to Andrew's, like these are actual tactical things that you can do, what role can philanthropy play as that gap continues to widen after the pandemic? And what do you think the most effective use of philanthropic capital in addressing some of that kind of safety net for those who are more vulnerable?
Yeah. So Rich, I do have a concern that in the midst of a crisis, a disaster, I mean, a lot of funds are pouring in now. And a lot of it is, it's very well used, but what I call palliation. It helps to make things better for people. And the recovery phase, which will be the next phase, I don't think philanthropic resources are we're putting our minds together to think forward, think about these big risks. I know Andrew, Binod, Cherie, they're doing this, but not enough. Some things have already been said, protecting supply chains and the food system. But I think we are really seeing that governments, NGOs, are limitations in how they're responding. Some are doing it better than others, but there are lots of gaps. I think philanthropy needs to take on a better leadership, a stronger leadership role to drive what's critical. I think we need to, in some cases, recreate new institutions, rebuild the commons, bring people together to solve problems, build capacity of businesses to be more resilient, build up community-based NGOs, lots of things to do, but I think philanthropy needs to take a bit more of a leadership role, as opposed to, I think right now government is dominating the work. Rightly so, but I think the next phase will be very tough because the thing is people are bringing perhaps for the rest of the year, to bring it forward now. People are looking very inward. They're becoming a lot more local, a lot more nationalist. So funding across borders is not flowing. I think we do think ahead and think more globally. Actually said that this pandemic is not even a black swan, right? Just imagine the black swans that are to come. We have to ask the bigger and tackle the bigger existentialist questions, including relooking at our neoliberal or capitalist system, relooking at globalization, climate change, some of these tougher questions that we will have to navigate for the longer term.
one of the things that we see in natural disaster response is whether it's earthquakes, tsunamis, and the like, is there's a flood of capital that goes in immediately after the event. But then the rebuilding takes such a long time because schools need to be rebuilt. There's often public health issues which result from those types of events. So staging philanthropic capital and then governmental response is often important. So Cherie, let me turn to you. When you think about both the pandemic as it is today and then a post-pandemic world, are there gaps in governmental policy that you think we can kind of offer today potential remedies for? And then how do we stage the kind of partnership that we're all talking about between philanthropic capital and governmental capital to kind of address these issues in the longer term?
Thank you. I think I really appreciated the discussions, I think, by the panelists earlier, and I just feel that there's so much passion and hope to do something better, and how do we really bring everything together. And we have been working with MIT for the past 2 decades, more than that, and on a leadership program that is called is a dynamic systems approach and youth theory. And we believe that there is a way, a process to get mindsets to open up. We call it open mind, open heart, and open will. So the head, the heart, and the hands. How do we get all 3 to align so that we can act? And we all have blind spots. So every sector, whether you are in the philanthropist, whether you are a government official, whether you are a fisherman, in Papua, or whether you are a teacher. So there's different blind spots. And how do we get people from across sectors to come together and work together? I think these are long-term investments, but are very necessary. And we have seen amazing outcome through these years of working with tri-sector leaders. I think we also government is one of the key partners. And I think we have seen this pandemic, how it has, we can see how those who have willing to open up, willing to collaborate, could actually shift the landscape. And for example, our fellow Bang Bang in the forestry ministries, how he reached out to the people in the forest to allow the children to be able to go to school, on the internet, and how they reach out to those, and the youth leaders who actually just started helping, these, because there's Indonesia is 70,000 islands. Some of them you can't reach without, there's just no transportation. So they go boat by boat to each of these places, and so educating and about the COVID and all that. But there's something, I think the finance is key, but I think there's a lot more that philanthropists can do in scaling up. So one of the things that I think Milken has been supporting us together with World Bank, IMF, many other global partners, OECD, we have this Trihita Karana roadmap on blended finance. And World Economic Forum and OECD has, Convergence have sort of facilitated this, and Milken has played a key role. So we had that forum in the last World Bank IMF meetings in Bali, where we the idea of blended finance is how do we scale up so that the government funds or the philanthropic funds are there to actually incentivize and crowd in private sector funding. Because these problems cannot be solved without private sector playing a major role, because that is where the majority of the 100 over trillions of assets is there on the private side. So how do we move that just even a few percent? And we were very fortunate at that event. We were able to, Indonesia launched the SDG Infrastructure Fund, the first one, and mobilized $3 billion. And then the $1 billion women fund was launched. Today, I was just talking to Cherie, who was one of the $1 billion funds co-founders, and she said she's doing $1 billion bites now. So in technology, women and technology to support. So I do feel, and we have OECD, we have just had a few Zoom calls to do. I think Milken is probably a part of that also on the COVID. So blended funds for COVID, and working with the government, we're trying to bring that into like G20 or others, so that blended fund for COVID will be part of that. But beyond COVID, I think this way of working together and scaling up funding so that we can really solve the SDGs. And I'm afraid we are going back on SDGs because of what has happened here. I think that World Bank numbers you have quoted, frankly, I think nobody knows what is going to happen because of what is happening now. So all the more, and I think just quickly on the Binod, what you said, I really believe, I agree with Andrew, how important it is to do the testing, but also there is the testing, tracing, and isolation. So the tracing, I think Singapore government has been early on that, and many other, I think New Zealand, others have caught on. And I think the stop the spread of the epidemic, we are creating a dashboard. So together with ICC, WHO, UNSCS, and Milken Institute just joined. I think thanks, Laura, for your support. And so how do we create a dashboard so that companies, countries, NGOs, we can all sort of have a dashboard of what can be done, and that would help us in solving this as quickly as we can. Thank you.
Great, thank you. Well, I know we're just about out of time. I do think one thing I would leave you with is there's cause for optimism. I think what you see now is crises sometimes spark innovation, and what innovation comes out of this crisis we can use to the next one, hopefully preventing it. And also this spirit of collaboration when you've never seen before. Drug companies that are former competitors and are working together to solve this crisis around the globe. Philanthropists are joining arms and trying to think of the most efficient ways to do what they can do. Universities and schools and corporations around the world are all pivoted towards this moment. And I think we have a great opportunity to learn from it, and that will give us some good guidance going forward. I want to thank all of our panelists for joining us today. I know some of you have meetings to get to. This is one of the series and the content changes, but we will make philanthropy and our ongoing sharing of best ideas part of our practice. So thank you very much.
Thank you, Richard.
Thank you, Rich.
Lauren.
All the best.
Andrew.
Okay. Good seeing everyone.
Stay safe. Bye.